Welcome back. Are you a parent or maybe planning to be? Well, here's Dr. Michael one of Guam's pediatricians, and we spoke to him about kids and vaccines. Good day, everybody. Welcome to this week's Health, Home, and Lifestyle. And with me is Dr. Michael You may know him, and he probably is your pediatrician for your kid. But enough about that. Let's get started. So summer is right around the corner, Doc, and our COVID numbers are really looking good. So let's just talk about vaccinations in kids, like the influenza, your typical flu vaccines, especially with summer rolling around. Would it be a good idea to have them vaccinated?
Typically, yes. Thankfully, summertime is not a huge time for flu for us, although in the tropics, these respiratory viruses can just kind of linger around all year round. But we definitely recommend that kids get vaccinated before it gets really bad. And for us, we get the flu vaccine around September, early October every year. So that's when the vaccine companies release a new version of it. And I would highly recommend it. Now, the flu vaccine isn't as efficacious as a lot of other childhood vaccines, and this is mostly due to the fact that the flu can mutate so rapidly. But still, it's generally the best protection that we get, and even with the efficacy about maybe in the 60%, I would highly recommend it.
All right, so Doc, even though our COVID numbers are going down, there are still parents who possibly don't want their kids to be vaccinated or are scared to have them vaccinated. So is there something you can share about the kids' COVID vaccine that's actually explains why it's good for kids and why it actually helps their immunity just in case we do have another COVID surge?
Right, so I totally understand when parents are a little bit hesitant because overall, and thankfully, like COVID is not something that hit the kids really hard, right? That being said, it is a brand new virus and there are a lot of possible complications down the line that we just aren't even going to be aware of. So, like viruses in general can do really weird things. Measles, for example, took us a long time to figure out, but a measles infection can actually reset your immune system so that you're basically have no immunity to things and you have to just regain it all back in. Really weird things, right? So with COVID, that's kind of where we land on it too. Like so far we know that the COVID vaccine is very safe. And especially with even the teen and the 5 to 12 doses, we've seen that they don't really get the side effects that a lot of the adults get because the dose is much lower. Now, if a parent is really just against it, there's not really anything I can say that's going to convince them. But overall, and I definitely vaccinated my own son, I think it's going to be the safest thing going forward. We don't know what the future is going to bring, and we don't know if there's going to be other mutations, but it's something I would want to give as the best protection I can to the kids that want it.
All right, Doc, so there's one thing that I'm curious about, and probably even some of the new mothers or those who are planning to be mothers. So if a mother is pregnant with her firstborn and she gets vaccinated, so does that actually transfer over to her unborn child?
Oh, that's a great question. There actually has been some studies, and yes, it does. So COVID vaccinated pregnant moms will actually pass some of their vaccine protection, and the kids will have it too. The other thing is if they're breastfeeding, you'll pass off some of the antibodies. And then if moms get infected with COVID, it's not always that the kid will get it too, but we still encourage them to breastfeed because they will also pass on some of the antibodies. So overall, it seems like pregnant moms should get vaccinated. By being pregnant, they're already in an immunocompromised state. And so we've definitely had some scary cases, especially back when Delta was cruising around, of moms going to the ICU. Now, it's questionable. There's overall both the American College of OB/GYNs and I think their other organization will say to get vaccinated as early as possible. Some people are waiting until after the first trimester. I say as long as they get vaccinated, that's the most important part.
So Doc, I'm guessing that this doesn't just apply to the COVID vaccine, but like any vaccine in general, right?
Oh yeah, definitely. So one of the things they'll check for is rubella status and hepatitis B status. And this is just standard thing that they did way before COVID. And so if a mom isn't vaccinated or lost immunity to it, they'll actually offer the vaccine for them. Tetanus as well. So yeah, it's sort of pretty basic stuff.
Right, Doc. So if you care to just educate me just a little bit, what other vaccines are actually good for newborns and toddlers and infants?
So the childhood series really starts at 2 months, and you get at 2, 4, and 6 months. So we have a combination shot called DTaP, and this is the general one that's available everywhere. DTaP stands for diphtheria, tetanus, and acellular pertussis. Pertussis especially is a really important one because we lose immunity as we get older. So we actually had an outbreak in Guam a few years ago where I think there were something like 30 kids that ended up catching pertussis that year. A few of them stayed in the hospital for a while. Tetanus, of course, that's the one we get every 10 years or so, and that's a great one to have in case there's ever like a wound. Haemophilus influenza is a really big one. This one used to be a big killer of kids before the vaccine came out in the 80s. I had never seen a case of Haemophilus influenza and in training, and my attendings hadn't seen one in probably like 30 years. I came out to Guam and I've seen 4 and 5 years. Every single one of them landed in the ICU. So definitely something I would recommend. We have PCV vaccine, which is covers for strep pneumo. Not so much that we care about the pneumonia part. The pneumonia part can be easy to treat, but it's really the complications. And really with all the vaccines, it's really the complications down the line that can be a lot scarier than the actual disease itself.
Right, Doc. Well, I guess just to wrap everything up. So, if there are parents who are a bit hesitant or have their own thoughts about not getting their kids vaccinated, is it highly recommended that they either talk to their primary caregiver or at least somebody well versed with children vaccines or like children health in general?
Absolutely, I can't agree with you more on that one. You just want to be careful where your sources are coming from. A lot of times when parents, I actually like hearing what they are thinking and where they get their information. And a lot of times when I look it up, it's usually somebody that's trying to sell them something, to be quite honest. So yeah, please go to your pediatrician, go to your family medicine doctor. We are people that essentially are dedicating our lives to the health of your kids and your family. And those are the people I think that you should be talking to.
Right, Doc. Well, is there something you would like to say to our audience right now? Just something about child care in general, not just about vaccines, something to actually keep their children safe and disease-free or even sickness-free.
Oh, disease sickness-free. That's kind of tough to say with this rampaging course of hand, foot, and mouth going around right now. But, the kids I think have been doing pretty good about keeping their masks on. Thankfully, the mask mandate will hopefully go away soon. But, just the usual things of, it's okay to go out and play. Hand hygiene is always going to be a good one. Get your kids some exercise, please. Let's not give them too much screen time. And, hopefully we can all get back to living life normally soon.
Up next is House to Home. Keep it here.